All right, well, let's talk about long-term care. Sitting across from me is Zach Shamberg. He's the president and CEO of the Pennsylvania Healthcare Association. So I have to be careful. Not home care, right? You're going to correct me right off the bat.
I'm actually more worried about the cell phones now, but yes, it's long-term care and nursing
So it's
homes.
long-term care. The one thing that we do have, we have an older state. There is no doubt about it. The population is aging, and that puts a lot of pressure on families about what to do when their parents and grandparents get to a point where they have to go into a nursing home or seek some kind of long-term care. In my family, we've had to do it. When I talk to people, almost everyone says long-term care, that sometimes they do call it home care, but you get the point.
Sure.
So take it.
And I'm one of those members of a family who has had to put a loved one into long-term care.
Yeah.
So like you, I understand it firsthand. You know, I'll say this, the statistics in Pennsylvania are very alarming, Terry. Our fastest growing demographic in Pennsylvania is age 85 and older.
Oh my gosh.
In 10 years, 1 in 5 Pennsylvanians are going to be 65 years of age or older. And we are about 3 to 5 years away from when the baby boomers are going to age into the demographic that is most in need of long-term care. Here's the really scary part. I was on your show about 6 months ago, and we talked about Pennsylvania being an aging state, and I told you that Pennsylvania was the 4th oldest state in terms of our population in the entire country.
Are you changing that now?
We are changing that. Now, it's not always good to move up the rankings.
I know. Well, you're living longer, so look at it that way.
That's right. We are now the 3rd oldest state in the entire country, and by the time this interview's over, who knows, we may be the 2nd oldest state. Yeah. But I'm here, as you know, on behalf of nursing homes, personal care homes, assisted living residences, and more importantly, the residents in those facilities who need to know they're going to be cared for, not just tomorrow, for the next 10 years.
So the governor's going to deliver his budget message. I think it's February 4. It's a Tuesday, and there are monies in that budget that go to long-term care. What's your expectation?
That's a great question. My expectation is that we are going to build on the strides that the legislature and that the governor made last year. And let me tell you about that. Last year, for the first time since 2014, almost 6 years, there was a meaningful investment made into Medicaid for seniors residing in nursing homes in Pennsylvania, which is fantastic.
Sure.
It's a great win for this state and for our population. And what's really interesting is that as I have traveled the state, and I've been in every corner of Pennsylvania, and I have talked to providers, and I've talked to staff, and I've talked to residents, and I've asked them, where did you put those extra dollars? And they're talking about resident bedside. They're talking about recruitment and retention of staff. They're talking about aging facilities, technological advancements. Every single dollar is being used to improve the quality of care here in Pennsylvania. So you're asking me what I expect. I'm expecting more of the same.
So the point you're really trying to make is that as the population ages, and you get funding from the state government, you get it from Medicaid in particular, but you also have a number of challenges that exceed that, correct?
That's exactly right. So I mentioned that there had not been a real investment in Medicaid since 2014. So what had happened in that 6-year span? I go back to 2018, and it was then that this problem really was exacerbated. Since 2018, there have been more than 100 sales, reorganizations, or changes of ownership for nursing homes.
Oh my gosh.
So put yourself in the place of a resident in a nursing home or the loved one of a resident. So what happens when a sale occurs or a change of ownership?
Oh my
Do you know that your care is going to continue? Terry, the really scary part is not so much Pennsylvania, but it's looking around the country. So you look at states like Connecticut, Massachusetts, Illinois, Texas. There's no sales, there's no reorganizations. There are closures. Nursing homes are closing their doors. Staff are losing their jobs. Residents are having to travel hundreds of miles to receive care.
We're going to run to a break. I want to talk about these workforce issues that I think are very, very important. But, but let me just add this. A lot of older folks who go into nursing homes at first are a little reluctant, and what I have found in my interaction is once they're there, they actually, you can't get them to leave. They build relationships. They actually enjoy it. Am I crazy? Am I wrong?
I can tell you personally, we've seen my grandfather thrive in a nursing home.
All right, we're going to deal with workforce issues in nursing homes, and we'll get to that after these words. All right, I'm chatting with Zach Shamberg. We're talking about nursing homes and the importance of long-term care for senior citizens. Now, you have a number of priorities for 2020.
Correct.
One of them, importantly, has to do with workforce issues. And you're not alone. I mean, there are a lot of folks in various professional businesses and commercial, of all kinds who have workforce problems. What's yours?
Yeah, that's exactly right. And you're right. You talk to any business in Pennsylvania or really around the country right now, with unemployment so low, workforce is an issue. You ask my priorities. My priority and the priority of the Pennsylvania Healthcare Association, and really the priority of any provider of long-term care around the state, is to provide high-quality care. We talked about the importance of Medicaid, and that is certainly important. I think it starts with workforce.
Right.
I think it starts with recruiting and retaining a skilled workforce, a workforce that loves to come to work every day, and frankly, a workforce that is good at what they do. But you would not believe the amount of red tape and regulation.
Yes, I would.
that prevents long-term care providers from simply hiring someone.
Oh, my gosh.
And, we talk a lot about Harrisburg issues. I'm going to bring up a D.C. issue now. We support a bill sponsored by Pennsylvania's own Congressman Dwight Evans from Philadelphia called the Nursing Home Workforce Quality Act, which would basically allow nursing homes that have not been allowed to have nurse training programs, resume those training programs once quality standards are met. Mm-hmm. So it's all about getting folks into the pipeline, getting them trained,
Absolutely.
And getting them into these facilities to care for our seniors.
Yeah. But there's also the business of how do you prevent waste, fraud, and abuse, and there's an act called the False Claims Act. I don't want to get into great detail, but what's the problem with waste and fraud and abuse?
Well, there's no problem with Terry, with waste, fraud, and abuse. And in fact, we talked about the importance of Medicaid and the fact that providers need every single dollar that they are given to provide high-quality care. So any opportunity to eliminate waste, fraud, and abuse from the system is an opportunity that we are going to take. However, a state False Claims Act, which was formally introduced earlier this week in Harrisburg, is not the way to do it. All a state False Claims Act will do is exacerbate what is already a very punitive legal environment in Pennsylvania. It will open nursing homes and long-term care providers up to more and more punitive or frivolous lawsuits, and it won't cut down on waste, fraud, and abuse. In fact, those Medicaid dollars are not going to be used at resident bedside. They're going to be used to defend more and more lawsuits. That is not the way to do it.
Okay, I got to ask you one other question, and I'm going to read it because it has a long Older Adult Protective Services Act. Older Adult Protective Services Act. Background, go ahead. What's that about?
So in healthcare, we love acronyms, so I'll abbreviate that, and we'll call it OPSA. So this is the OPSA Act, and this is another example, like the State False Claims Act, where best intentions can have unintended consequences on providers, on staff, on residents. The Older Adult Protective Services Act was ruled unconstitutional in 2015. Ever since then, we've been trying to get it back to where it needs to be. And it does a lot of things, but one of the things it does is allows long-term care providers to hire folks with criminal convictions, which is something that we should be doing here in Pennsylvania. However, as the bill is currently constructed and has been constructed over the last few weeks, it's not something we can support. It adds more red tape. It adds more bureaucracy. We want to get this done, Terry, but we want to get it done the right way.
All right, I'm giving you an assignment, and that is in a couple of months, I want you back in here after the governor's budget so we can explain, so you can explain all this. This is hugely important. I call it long-term care, whatever, nursing home care, whatever you want to call it, it's critically important. All right, I'm holding this up, legal, illegal, to use it while you're driving. We got a couple of great reporters that are going to come in and help us understand that. Plus, we have other subjects we're going to deal with.